Hi, my name's Kate Cogan. I'm a mental health nurse and a general nurse and a clinical family therapist. And I work for an organisation called Outcome Health. We're based in Blackburn in Melbourne, and we provide mental health supports across the state of Victoria. I think mental health nursing's core business is to work holistically with people, how our physical health impacts on our mental health and how our mental health impacts on our physical health. And one of the most, well, probably the most important thing is how we engage with people. And that's something mental health nurses do really well. Our core business is to help our clients become as well as they can be and travel the journey with them. And everybody's journey is different. And to recognize that, not to impose other people's journey on a new patient. Every new patient will have their own journey, and it's our job to explore that with them. Well, mental health nurses work across the lifespan. We can work in aged care, we can work in schools, we can work in GP practices. I think that's probably at some level where we do our best work, is working with GPs, because we can work collaboratively with the GP and the practice nurse to see if people haven't had their bloods done or males haven't had their PSAs done. We would make sure that they go to the GP and get that physical aspect looked after while we're looking after their mental health aspect. Mental health nurses have all got postgraduate studies in mental health nursing, and most mental health nurses have further studies in different therapies, DBT, CBT, mindfulness, all that sort of stuff. And we're also aware of medications, and we check mental states, we check responses to medications, how they're going with their doses, are they compliant with their medication, are they due for new meds. Mental health nurses work holistically and collaboratively. However, they are also encapsulated in the medical model, but have therapies outside the medical model. So they sort of bring the medical model and the psychological model together quite nicely. Well, from my point of view, where I have sat in my career, I've seen some wonderful changes, especially under the Mental Health Nurse Incentive Program, which is no longer funded, but hopefully we might get back to that one day, where we were putting mental health nurses in GP clinics, and we were keeping the client engaged in their GP clinic. Therapy was happening in the GP clinic. The GPs knew what was happening. The practice nurses knew what was happening. I thought that was a really one of the best models of mental health nursing. We've also introduced mental health nurses into the 000 calls at Ambulance Victoria, which is a fabulous new career pathway for mental health nurses. We take all the mental health calls that come into 000 and we try to triage to see whether do they need to go to hospital? Do they need to go to hospital in an ambulance? Is there another community service that might be better place to look after these people instead of sending them to a hospital? And that's a fabulous service. And we're diverting a significant number of ambulances. So that was a world first when we introduced that 8 years ago. We've been doing that. I think putting mental health nurses in the community is what keeps people out of hospital. I also think another good direction, and some schools do have a mental health nurse in them, but I feel there should be a mental health nurse in every school. What we do know is people that have good mental health support in their schooling years are less likely to go on and become unwell in their adult years. So it's a really important preventative factor. And I think we could do a lot more in that space. I think multidisciplinary care is really important in caring for people. As I said before, when I talked about working with GPs, with general nurses, with social workers, helping with housing, with occupational therapists as well, psychologists. We often might share a patient where we might look after the more severe and complex aspects of mental health and physical health. Psychologists might do some CBT, management of anxiety, things like that. And working together, I think it's really important. We need to be communicating as a team so we don't get split off in our treatment. But good teamwork is really effective and helpful, and helps people become more resilient and live their best life, which is really what we're all focused on. My first word is curiosity. If you like learning, there's an awful lot to learn in mental health. Learn about yourself, learn about other people, learn about different cultures. It's never ending, the learning that we can do with research, in medication, in diagnosis. There's so much to learn. So if you have a curious brain and you like to switch it on, then switch it on with mental health nursing. My second word is support. If you find that you're a supportive person and you like supporting people, then mental health nursing could be a good career for you. We have lots of opportunities to sit with people and support them through difficult times, and again, help them learn about themselves. The more we know about ourselves, the better off we live our life. My third word is opportunities. There are opportunities everywhere across the globe, across tertiary. You can work in hospitals, you can work in community, you can work in schools, you can work in aged care. There's numerous opportunities and developments moving forward in how mental health nurses can impact people's lives.